so tell us what makes your patient care different from your other competitors.
I think what makes our patient care different is that you become one of the family. I think patients feel at ease and comfortable around us, and I think that's a big part of their journey, especially when you come in pain or nervous, that feeling comfortable is key.
Mm-hmm. Agreed.
Mm-hmm. Anything else?
You get to work with all of us.
So what's it like to work for Dr. Alex?
Go ahead. I want to know.
It is the best job I've ever had.
Okay, someone else.
Working for Dr. Alex has been the best job that I personally have ever had. It's a mix of having a really high expectation with understanding and care in the back tone of all of that. So, the expectation is that we work hard, but she's also got a very warm and nurturing side to her. So it helps in a lot of stressful situations.
That was nice.
Well, that's true.
Every day is a whirlwind. I feel like it's like full throttle in the best way.
Mm-hmm.
It's
but fun at the same time.
Yeah, we have a really tough job, just the nature of the patients that we work with, but we have a really fun time, and you have to do that in order to handle how hard it can be. But working with Dr. Alex she always keeps us on our toes. Like, hey, actually, I'm not here next week. Oh, okay.
Forgot to tell her.
You don't have that full schedule on Thursday, you're going to have to move it.
About that.
How do you do that?
Okay.
And then this next one's for each of you to answer on your own. So what's the most important lesson?
I would say important or first lesson you learned, like, in the office.
I have to think.
I know. When I came to Dr. Alex, the first lesson that I feel like was drilled into my head was, especially with what we do, assume nothing. Ask questions. Questions have questions have questions. Assume nothing, because as soon as you do, it's always going to be incorrect, and we're all going to be in a whirlwind of how do we get out of this. So I learned very early on to assume nothing.
Oh, that was good.
I learned not to touch the thermostat, even though I still do touch the thermostat sometimes.
You're not supposed to do that.
Yeah. But also just there's a lot of kind of open boxes, like in checking my boxes at the end of the day. But more importantly, one time a patient was here and their case wasn't in yet, and that was a big uh-oh. So I learned very early on to make sure everything's here, because it just throws off the whole day.
Weren't you on vacation?
I was about to leave for Florida, and I was like, I think my boss hates me right now.
I'm gonna go now, you guys.
May not have time to come back. Yeah. So, yeah. Danielle?
I think one of the things I learned early on was just honestly to write everything down, because there's so many moving parts and there's so many balls in the air with just what we're doing with each patient. If you don't write it down, I will forget for sure. But it's easy to forget something from the front desk to walking to the back of the office to talk to Alex in her office. So if you don't write it down, you're going to lose it.
Well, that helps us, like,
Communicate.
Yeah. Hey, did you get this done or not?
Yeah.
Yeah.
Okay, Dr. Alex, you have any little...
Things you learned.
Things I've learned?
Yeah.
Working with yourself.
I've learned I can be hard, but that doesn't make me stop. And I think that maybe I've learned a little bit of deep breathing, or just like it's going to be okay. They'll figure it out. So I think I've learned to trust them a lot more and know they're going to take care of it.
Not to be reactive.
Yeah, I'm still working on that one.
Okay, perfect. Next one will be what inspires you day to day. So what makes you kind of get up and come into the office, makes you excited?
I can go. What inspires me day to day, like we've mentioned many times, it can be a very tasking job dealing with people that are in pain. But just when you're feeling like, oh my gosh, I'm so tired, I can't deal with this anymore, you get on the phone with somebody and you give them a glimpse of hope that they didn't have before, and it just makes all of it worth it. It makes the next day that you come in, you can do it because you're going to have another one of those phone calls at some point. So I think that's it for me.
I would agree to that. People that you're providing them life-changing dentistry, whether it is providing them a new smile that they've always wanted and giving them their confidence back, or the other side of that, someone who has suffered in pain and they can't work, they can't be a parent, and to be able to say you've given them their life back, that it's very, very rewarding.
Yeah, I mean, I agree to all that. At the end of the day, that's it. That's why we're here, right? That's why we do what we do. It's to help people.
Yeah. I agree too. I think just like Danielle said, giving hope to the hopeless.
Yeah. Just hang in there.
Yeah.
We'll figure it out.
Okay, two more. How do you define results for a patient?
I think actually the patient determines that, not me. The patient will say, I don't have headaches, I don't have pain, I feel better, I can get up and exercise again. So it's not me determining it, it's me helping them get in a comfortable position, but they're the true determinants. They're the ones that give me the thumbs up. I'm good. Don't you think?
Totally.
Yeah.
Yeah. Oh,
That's a great answer.
yeah.
Thank you.
Okay, last one from me. You have a lot of people, you guys kind of touched on this. They come in, they were maybe a little bit insecure. You guys start boosting their confidence before you even give them a new smile. So how is your approach a little bit different in terms of kind of helping them before you even help them?
I think giving them the, sometimes they don't think it's like a possibility to have some sort of change.
It goes back to the hope.
Right, yeah. So like they come in and they're just like, can these things even be done? Is this even a possibility? And so then kind of painting that picture for them and showing them the process and making them feel comfortable gives them that, hope of if this is going to happen, I'm finally going to do this. And then they're confident in the results that they're going to get because she's been doing this for so long. So that it's just, we're confident in her work. And I think that shows to the patient that they know that, this is what we do all day, every day. And she's good at it, and we know that, so therefore it's something we can portray to them that makes them feel better.
Yeah, and I think too, it's just from creating that experience from the moment they walk in the door. Everybody had their first experience walking through our doors the first time. It's just comforting. It's not the typical dental office, and we try to be that on the phone too when they're calling in for the first time. It's not the typical phone call that you're going to get, and that's the whole start of the patient experience. And once they get in and get started, like Ashley said earlier, they just really become part of the family.
Yeah.
Okay, I guess one thing, follow up, sorry. I'm like, wait a minute. Follow up, so if somebody's like nervous and they want to have a fix, but they're nervous to come talk to someone and show someone about their insecurities, what would you say to them? Like, what would your reaction be?
I would say just call.
Yeah.
Call, and once you talk to one of us, we'll help you walk through like the reason for your call, what you're looking for, to kind of ask specific questions that maybe you didn't think were a relation to how you're feeling. So honestly, just pick up the phone and call us. If we don't answer, leave a message, we'll call you back, promise. But honestly, I think from, it's not one of those things where you call them or just like, what's your date of birth? Let me get you in. Like, I want to talk to you. I want to know more about you. I want you to explain to me what you're feeling, because I'll tell you, hey, now's the right time for you to come in, or, you know, maybe do something else first. Like, there's definitely, everyone's different on their journey, and we are trained in a way that if you just literally call, we'll be able to help you find the right time to come in and navigate it.
Help you. And I think one thing is like we're a no judgment zone.
Right.
Yeah.
You know.
Right.
So, you know, we don't judge. Okay. The best thing is to take that first step and to come in and to just sit and talk. Nothing is going to be done, but we got to make sure we're on the same page and we can deliver what you're looking for and meet your expectations and just be honest with you. But there's no judgment.
We've seen it all.
We've seen it all, we've done it all, and we fixed it all.
Yeah.
Yeah.
That's great. Do you guys have any favorites? Sorry, I keep coming. Any like favorites that really stand out? Big transformations, like over all time.
God, we've had a lot.
There's a few. I mean, if we're going off of even just today, I think Josh from earlier, his transformation, just a young professional, and he needed a smile that fit him,
Right.
and now he has that, and it's just so amazing to see. Those are so incredible to be a part of.
And
Well, and then too,
Josephine.
She's in her
80s.
80s,
Yeah.
and she's like, nobody will fix my teeth. I'm like, oh, sister, I will fix those
she
teeth.
loves them. They look
And she
beautiful.
does.
And she's happy. I mean, she's so
Yeah.
happy.
So,
Yeah.
She's so happy.
She makes me smile every time I see her and see her smile. Like, you can't help but smile.
Yeah.
She's like the living proof that you're never too old to have anything done.
Right.
Yeah.
Right. When people say,
Right.
"Oh, I'm too old for that," or "Oh, I'm,"
If I was in my
if I'd have done this
40s, I would've
30 years
did it.
ago,
Yeah,
right?
I would have spent that then
Yeah.
or whatever. And it's like, why
It's
not
never too
now?
late.
No.
Why not now?
Yep.
It's
Enjoy
not.
it.
Right. Right.
That's great. Good. You guys did great.
You guys are awesome.
All right.
Now we can go get a beer.
Yeah. Let's do this.
Here's this. Al, you're
10
connected.
minutes.
Al. Yep.